Hello and good evening. This is U.S. Congressman Alex Mooney, and thank you for joining my live telephone town hall meeting this evening. I represent you in Congress in the 17 counties in West Virginia's 2nd Congressional District. We are calling you here live from my Martinsburg District office right now. Tonight I'm calling constituents across the district to talk about the coronavirus epidemic. I am joined here in the office today with Dr. Emma Eggleston. She's the Dean of West Virginia University's Health Sciences Eastern Division in Martinsburg, and Dr. Matthew Simmons from the Infectious Disease Clinic in Martinsburg. Dr. Eggleston and Dr. Simmons and I will be answering your questions this evening. If you have a question, you may press *3 on your phone at any time to get into the question queue to get live on the line and ask your question. Again, *3 to get into the question queue. And again, this is U.S. Congressman Alex Mooney, and you're currently joining my live telephone town hall meeting on the coronavirus. Thank you for joining me this evening. I'm eager to hear feedback and questions and concerns you have and give you an update on the coronavirus response by the federal government. On December 31st of 2019, the first cases of coronavirus were reported in Wuhan, China. Since then, the coronavirus, or COVID-19, has spread from China to Japan, South Korea, Thailand, and eventually the countries around the globe, including the United States. On January 30th of 2020, the World Health Organization declared a global health emergency amid the spread of the disease. One day later, President Donald Trump restricted travel from China, a swift and decisive action that brought our country some much-needed time and likely saved lives. Again, this is U.S. Congressman Alex Mooney, and you are currently joining my live telephone town hall meeting. You may press *3 to get in the question queue to talk live on the line with me or the two doctors we have here to ask any question about the coronavirus. On March 4th of 2020, Congress acted by passing more than $8 billion in an emergency funding to initiate the coronavirus response. That money goes to the Department of Health and Human Services, including the Centers for Disease Control, to stock up on necessary medical supplies. Additionally, hundreds of millions of dollars goes to the National Institute of Health towards the research and development of vaccines, treatments, and tests for the virus. The funding also provides funds for state and local governments to actively begin their response. It's imperative that all levels of government have what they need to address the crisis in every town and neighborhood of our great state. I supported the emergency funding because I thought we needed to tackle this crisis head on. Again, this is U.S. Congressman Alex Mooney, and you are currently joining my live telephone town hall meeting. Please press *3 at any time during this call to get in the question queue to talk live on the line with me and the medical experts I have here in the office with me. In the last 2 weeks, the coronavirus has continued to spread. The World Health Organization declared a global pandemic last week. Meanwhile, the number of cases and deaths in the United States has continued to grow. As a result, further precautionary measures have become necessary. President Trump also announced a temporary travel ban on foreign nationals from Europe in order to lower the risk that new infected people will enter the United States. If you have loved ones overseas, do not worry. All U.S. citizens will be allowed to re-enter the country. The Centers for Disease Control also advises that we take common sense precautions. Remember to wash your hands more often and scrub with soap and water for at least 20 seconds. Stay home when you are sick. Clean and disinfect frequently. Touch objects and surfaces, and refrain from touching your eyes, nose, and mouth. Additionally, those above the age of 60 should stock up on supplies such as over-the-counter medications and groceries in the event that you need to stay at home for a period of time. If you're just joining in, again, this is U.S. Congressman Alex Mooney. You are joining my live telephone town hall meeting this evening, and you may press *3 at any time to get into the question queue. *3 at any time. To stay current on health updates from your local county health officials and the Centers for Disease Control, you may go to the website cdc.gov. cdc.gov. In just a moment, I'm going to have Dr. Eggleston and Dr. Simmons introduce themselves, and we're going to go to questions. There are some questions in the question queue already. But if you're interested in receiving updates from me about the coronavirus, you may subscribe to my newsletter at mooney.house.gov. That's mooney.house.gov. I remain in continuous contact with the Trump administration and relevant agencies about the virus response, and we're monitoring the situation constantly. These coming weeks will be a challenge for our country, but we have faced worse. If we remain vigilant, practice common sense, we can get through this together. This is not the first global health crisis we faced. In just the last 2 decades, we've seen several global outbreaks, including SARS in 2003, avian in 2008, swine flu in 2010, MERS in 2012, Ebola in 2014, and the Zika virus in 2016, to name a few. We will endure this struggle just like we have through other struggles and crises. So next, I'm proud to introduce our distinguished guests tonight. First, Dr. Emma Eggleston, and the guests are Dr. Emma Eggleston and Dr. Matthew Simmons. Dr. Eggleston is the Dean of West Virginia University's Health Sciences Eastern Division in Martinsburg. She attended public medical and public health school at the University of North Carolina at Chapel Hill. She completed residency training at Brigham and Women's Hospital and endocrine fellowship training at the University of Virginia. Following the fellowship, she was on the faculty at the University of Virginia and Harvard Medical School. And then Dr. Simmons is also with us, Matthew Simmons. He's the Director of Infectious Disease at West Virginia Medical East. He's a specialist in infectious diseases and has been closely monitoring developments surrounding COVID-19 in West Virginia. So without further ado, I'm going to turn it over to Dr. Emma Eggleston to introduce herself and make any comments she has.
Hello, everybody. Thank you for joining us, and thank you, Representative Mooney, for inviting us. And I wanted to thank Dr. Simmons, who is a real expert and will be answering many of your questions. I wanted to let everybody know that at the health system level in West Virginia, a tremendous amount of work is going on to help prepare for cases and how to approach them, and there's a lot of coordination between the outpatient clinics, urgent cares, emergency departments, and hospitals, all working together at the sort of task force level that's very collaborative. There's also a lot of collaboration with the Department of Public Health. So we are doing the best we can to prepare to help protect our community and then also help protect our staff and providers as best we can, and to help educate and communicate with everybody. One thing that I think, in addition to the many things that Congressman Mooney recommended everybody do, I just wanted to comment on social distancing, which is all of us working on farther apart from each other than we're used to. And, that's critically important in helping to prevent the spread of the virus as well as protect the most sort of vulnerable amongst us. But it can also be really stressful for people and can lead to social isolation. And while we have everybody, I just want to urge checking in on your elderly neighbors and, helping them do errands or go to the grocery store, or just reaching out to them for companionship. The other thing is, with our schools being closed, being mindful of helping our families get the food they need, and so supporting our food banks, our local ministries, our other organizations that help support our families with food, transportation, and many other things. And I would agree with Congressman Mooney that, we're all in this together and we will get through it all together. And then I'll pass it on to the real expert in the room, which is Dr. Simmons.
Thank you, Dr. Eggleston. Dr. Simmons.
Hi, thank you for having us. I just want to reiterate to everyone out there listening, the first thing you do in any crisis is check your own pulse. Take a deep breath and remember we're all in this together. The great state of West Virginia and WU hospital system has your best interest at heart, and we will continue to work together as one people in one state to make it through this.
Thank you. Thank you, Dr. Simmons, Dr. Eggleston. All right, let's go ahead to our first question, and that would be in Clay County. Just give me a second. And Susan from Clay County, you're on the line with our first question. Go ahead, ma'am.
Okay, I'm interested in the coronavirus, how long it lasts on surfaces like doorknobs, furniture, sinks, anything like a wall switch. I clean everything. So cabinets, how long will it last?
Right now, based on the best evidence that we have, it's probably 3 or 4 days that it remains infectious on surfaces that are particularly smooth. It's different for every type of surface, but 3 days to 4 days would be the time that you'd be really most worried about it, and when you would want to do your cleaning on the areas that are considered high-touch areas or areas that are touched by a lot of people or are touched very frequently.
Okay. Thank you.
Okay, thank you. So we'll go ahead. Done, and then click live on that one. Thank you. Again, if you're just joining in, you're live on the line with Congressman Alex Mooney, representing the 17 counties across West Virginia's 2nd District, from the Ohio River all the way to Potomac River. We have live in the office here with me. I'm calling you from my Martinsburg District office right now, here in Berkeley County, West Virginia. We have Dr. Emma Eggleston and Dr. Matthew Simmons here with me, and I thank you both for coming to answer these questions. That's of great concern to folks around the state. And you may press *3 at any time to get in the question queue. I think a lot of the questions from what I'm seeing are similar, but let's go to Greg from Kanawha County. Greg, if you're on, go ahead, sir.
Hi, it's actually a she. And
Okay.
I was wondering if you all agreed with the Senator Manchin was reported to have said on CNN that our absence of the virus or confirmed cases was possibly due to the fact that we haven't been testing. He hasn't been supplied with tests in West Virginia. And I was wondering if you would comment on that.
Sure. I mean, early in any kind of outbreak, the places that are hardest hit get a lot of the initial resources. We're fortunate in West Virginia that we don't have a lot of areas that were hard hit early on in the outbreak. And because of that, some of that testing has been allocated to places more devastated by the virus. I think that you will see cases in the near future, and there may be cases out there that we're still trying to catch. But it is probably a delay in the fact that West Virginians have good social distancing by nature, and some areas where we don't have people crowded up like large cities, why you haven't seen any positive cases at this point.
Did I answer your question? Wait till I get this. All right. Thank you again for that great question. We have several questions like that. That question was, what was that? Tests. So are there tests now? If somebody wants to go in the local hospital or their primary care physician, can they just go get a test? Again, this is Congressman Alex Mooney. I'm asking this question, follow-up question to that. What does someone do if they think they need to get tested? Or do they need it? I mean, people think they need it, but do they? Go ahead.
Right now, the President has asked us to prioritize people who are highest risk, people who have traveled to highly endemic areas of the virus, healthcare workers, people in the front lines, because while there are tests, we're still ramping up to get a lot more. In the near future, you'll see a lot more tests. But right now, not everybody who has symptoms even do we want to prioritize the test. We want to make sure that the people who are in contact with the most people or have the highest risk for bad outcomes are who we're testing in these early phases of testing while we're trying to get enough tests out there. I think that eventually there will be enough tests for a lot more people to get it, but right now we're trying to prioritize those people that we think are highest risk for bad outcomes or who are going to have a lot of contact with people.
Okay, go ahead. We have another follow-up question on testing from Ravenswood, I believe. And Patricia, if you're on the line, go ahead.
Yes, I was just wondering about these announcements that we had tests pending. And this is from the beginning. The first was 1 test. Now we have 4 tests. Why are we not hearing about results?
So currently the testing process requires about 2 days for us to get results back on. And so a lot of the delay in the test is you have to go through the process of making sure the person meets the criteria for a person under investigation, collecting the sample, sending it off to the lab processing it, and then returning results to us. So there is probably a delay based on the fact that it takes some time to run the test and get the sample to OLS in Charleston, which is our capital where that lab is being, those labs are being processed. Also, there's so many people trying to get tested at once that the labs were a little bit inundated at first, and so it was hard to get all those tests promptly back at the same time. So you're seeing that scatter effect. It should be clearing up right now. OLS is doing a very good job of getting caught up. And as the private sector adds its abilities, you'll see that testing time drop and those tests return much sooner.
So as a follow-up to that as well, someone maybe, I don't know, has a sore throat or something, like how do you decide if you should request a test? What would the symptoms, or what would you advise if someone calls you and says, hey, doctor, I think I might have it? Like, what do you vet that for before you say, come get a test?
Well, right now we're looking at a constellation of symptoms of fever, cough, and shortness of breath.
Fever, cough, shortness of breath, okay.
And no other identifiable cause, like influenza or human metapneumovirus. There are numbers that you can call, including the state hotline, which where they process that information. If you have questions about whether or not you should get tested or could get tested, the state hotline, which is 24 hours a day, 7 days a week, is 1-800-887-4304. That number again is 1-800-887-4304.
Hope someone's standing by. Go ahead, Dr. Eggleston.
And just to add to that, a reminder that there's still other viruses, common respiratory viruses, including the flu, still in our West Virginia communities. And so people can have symptoms, but it's related to our sort of standard late winter, early spring viruses that are circulating. And the flu has had a later season this year and been around a little more. So just because a person has symptoms, there are many other things that can cause cough and a fever.
Flu season right now? Is it flu season right
Till
now?
the end of it, yes.
It's the end of flu season?
Taper it off.
And why, I heard somebody say when the temperatures get higher that the flus go away. Is that true? Or
it's an old adage that's true, and it's because people tend to group up, and when it's cold, stay in the house close to one another, and people tend to go to work and sick. And when it warms up, people go outside, they get away from one another, they kind of start naturally social distancing.
So it's a social distancing more than the temperature.
Yep.
Interesting. All right, let's go ahead and take another call here. Again, if you're just joining, you're on the line with Congressman Alex Mooney and my two guests, Dr. Emma Eggleston and Dr. Matthew Simmons, experts, medical doctors and experts in this issue, following very closely the coronavirus. We're having a coronavirus telephone town hall. So Lisa from Martinsburg, you're on the line. Go ahead.
Yes. My husband is a paid paramedic. How are they going to, take care of, or how am I going to say it? Check on the spouse, because they're going, the husband is going to be around it daily, taking patients back and forth, and then coming home to the spouse.
Well, there's a lot of discussions going on. We met with the Department of Health. There was a large meeting with all the community players. We're still kind of addressing how we're going to do that. Historically, the Department of Health has traced contacts, and we are going to rely on the excellent leadership that we have at our local and state health department to continue to work that kind of process. There's some built-in processes by the health department that track contacts.
Does that answer your question, ma'am?
Not really. The second part is, how are they going to quarantine them? Are they going to quarantine them away from their spouse, or quarantine the spouse and the
So if someone gets quarantined,
medic?
this just happened to my cousin, who's the mayor of Miami, Florida. He came down with it, and he's quarantined away from his wife and two small children. So if someone does have
he's already have come home with it.
Yeah. But he's not with his wife and kids. He's by himself. So if someone has it and they are quarantined, I think the question is, are they with their spouse, or are they by themselves?
No, they're cautioned to be away from their spouse.
Okay.
But he's already.
Okay, he's ready. She's saying it was already. She may have already been exposed to it. She feels, but nonetheless, the still advice is by yourself, right?
Exactly.
Yeah. So whether whether you think you've been in contact or not, or you have obviously been in contact, your family, you still, if the person actually has it, is tested and showed to have it, at that point, the advice is to go ahead and quarantine away from loved ones and everybody. By yourself for what? How long?
They're saying up to maybe 14 days.
To 14 days. Okay. So that's the idea. By yourself. So quarantine means all by yourself. We have a lot of questions in here. If you want to get into the question queue, please do so. But we're going to go to Mr. Birch and Scott Depot. Star 3 to get in the question queue. But Mr. Birch, go ahead.
Hi, Congressman Mooney. Thank you for taking my call. Sure. I don't really have a question. I have a suggestion on how to help some folks.
Okay.
A lot of us have IRAs and 401ks that we could be drawing on. However, there is a 10% penalty applied by the IRS. Has there been any thought about waiving that 10% penalty short term for certain withdrawals?
That is a good idea. I happen to be on the Financial Services Committee. That's my only committee assignment. I'm very focused on that. So we're looking at ideas in the financial sector and banking and investing, and that's an idea we could look into, especially if this continues and the economy struggles more and people need those funds. I think that's a very reasonable suggestion, and I will run that by some folks in D.C. Thank you.
Thank you.
On my drive over here, I had another suggestion, which was to let people pay their interest-only loans on that they have for small businesses. Just pay the interest only for a while if they're struggling financially. And I've already emailed that along to my contact at the White House. So these suggestions are very helpful. If you have other suggestions, go to my website, mooney.house.gov. Again, mooney.house.gov. And if I don't get to your question today, because we have a lot of questions here, you may submit that question there, or call my office in D.C., which is 202-225-2711. I'll repeat all that at the end of the call. There is one question here that I just want to ask. It's been on my screen for a while. It's probably a quick one. The flu shot. People get the flu shots a lot. Does the flu shot help in preventing or prevent COVID-19?
No, it does not.
It does not. Okay. So if you're listening on the line, that was your question, there's your answer. The flu shot does not prevent COVID-19.
Yeah, and maybe that's an important distinction for your caller, is that the vaccines are very specific to the type of virus. So the virus is a family of type of infections, but there are many individual cousins, and the vaccines are specific to that cousin. Is one way to think about it, and the flu is quite distinct from coronavirus. Is that the case, Dr.
That's
Simmons?
absolutely correct.
So it's a flu. It's a virus, not a flu. Gotcha. So it does not. So the flu shot does not help with this. Okay, go ahead. We'll go to the next caller again. Thank you for calling in. We're calling the 17 counties across West Virginia, doing a live telephone town hall meeting, and we're going to go to Wanda. You're on. Go ahead.
I had a question. I was watching the news today at noon, and one of the doctors that were on there said to avoid the dentist, not to go to the dentist office. How do you feel about that?
I think it's a good idea. Some of the things that increase the risk of transmitting the virus are things called aerosolization. So any procedure where water or vapor is being sprayed increases your risk of droplet contamination, which is how this virus is most likely spread. When the dentist uses a vacuum or the water jet in your mouth and it creates droplets, I think it's reasonable at this time to avoid that unless you absolutely need to go.
Okay, thank you so much.
You're welcome.
Are dentist offices staying open?
Not all of them, until some states have them open.
Some states have them open? Okay. Thank you. Thank you, Wanda, for that. Thank you for calling in, and we'll just go right to the next question here. And I really appreciate the time from the two doctors here. I appreciate you coming to my office, too. It's a lot easier logistically. I know we have a lot of folks concerned about this. So we have Angela from beautiful Braxton County. Go ahead, Angela.
Thank you for taking my call. My husband is a 67-year-old postal worker, and I have a lot of friends that are seniors that are raising their grandchildren and still working at full-time jobs. But they're suggesting that the elderly stay in. And I wonder if there's something that we should do to protect our elderly that are still working full time.
I think that's a great question, and some business places, including West Virginia University hospitals, are looking at some ways to minimize the risk to these people, including removing them from direct patient or person-to-person contact, allowing them to do office work, allowing them to telecommute. It absolutely is a good idea if it's at all feasible. I think that your husband and your friend should talk to their employers. A lot of employers are making some exceptions for those senior citizens and those more mature adults to allow them to be in safer positions. It's definitely worth that.
It was suggested to my husband today to get a medical leave slip and have it filled out and probably take off. But that's not an option for a lot of my friends because in Braxton County and other counties in our state, our whole state basically, are raising their children because of all the drugs. And, you know, they don't have those options. So what's going to be done to help those? You know, we have special times for the elderly to shop and stuff like that, but all the ones that I know are still working full time.
Yeah, it's a conundrum that we're still trying to work out. I think that by increasing the ability of those people to do some social distancing in their work, that's really all we can do right now and support them in any way we can with help their risk to sick people.
And just to remind you what social distancing means, is if it's possible for them to stay 6 or more feet away from each other, and then, of course, wash their hands really frequently. So even if their employer can't give them tasks that sort of are away from other people fully, at least having them in a space where as best they can be further away from each other. Now, if you're, you know, delivering mail or doing something where you're not in close contact for a long time, that's a little different. But if you're in an office space right close to each other where it's prolonged exposure, it's best if you can be 6 or more feet away, and just everybody remember, wipe down surfaces and wash your hands. Is that correct, Dr. Simmons?
Absolutely. Remember, close contact is considered closer than 6 feet for more than 10 minutes.
Okay. I believe we might have Dr. Brent Watson from Roane County on the line. Dr. Watson, are you with us? No, let's go to the next caller. So we're going to try to get an update from Roane County later, but let's go to the next caller. You know, and I'll just, in between, again, you're on the line with Congressman Alex Mooney, Dr. Eggleston, and Dr. Simmons. Thank you again, doctors, for joining us. One debate I had with another congressman about the airborneness of this, I don't actually see that in the questions, but this relates to social distancing. So if somebody sneezes or coughs or, you know, is this considered airborne virus, or is it considered a not airborne like other viruses?
So the CDC is currently diagnosing this, recognizing this as a microdroplet. And in 2010 or so, they updated that to be 6 feet is the silo or area in which a cough droplet expands out away from the body. So even though we're being very cautious, recommending that people use airborne precautions, it's most likely a droplet transmission. If you remember when we first saw the flu come back, the H1N1, we did airborne for a while until we were able to determine that it definitely was droplet. So one of the great things about our CDC is that they're always very cautious at first, and I think that's well warranted. But it's probably droplet contact, and it's probably, if you're outside of 6 feet, you're okay.
And can you explain the difference for people on the line between airborne and droplet?
Sure. Droplet is within 6 feet, the little particles that actually coughed out of your mouth go out and kind of take an arc down towards the ground, where airborne, when you cough, it goes up and stays up in the air for several minutes to up to an hour. So airborne is much more concerning, like measles.
Gotcha.
Where droplets like chickenpox and things like that are out and down away from you.
Gotcha.
And this virus seems to be out and down.
Right.
Yeah.
Okay. Yeah, I had a call out of the hospital about that before I voted on the last bill. But we have another caller on from Elkins, Pam. Go ahead, Pam.
Hi. Thanks for taking my call. My husband and I are senior citizens, and I just got out of the hospital with the flu, and I'm on 24-hour oxygen. Now, when he goes to the store to buy groceries, Should he stay away from me? And if so, for how long?
So you're saying that your husband's going out and buying groceries. I don't think that every single trip that you take out is high risk. I think that you have to use your best judgment. And West Virginians are smart. They know when they're taught something, they don't forget it. I think that really we need to look at things like if he goes into a high-risk area where there's a lot of people that could be specifically contagious, like a hospital or a nursing home, that's very different than the casual kind of walk-by thing that we were in the grocery store.
Okay.
Because you're just passing by people, and if he can distance himself away from people, as long as he's not standing in line close to somebody that's coughing, he's probably okay as long as it's casual pass. I would encourage him to go on off hours when there are not a lot of people there.
Yeah, well, I just wondered if they were going to start in Elkins like they do in the bigger cities where maybe at 7 in the morning from 7 till 8, they have for senior citizens shopping and people with lung problems or heart problems, high-risk people. So far, none of the stores here in Elkins are offering that because I've called them all today.
Well, I think that's a great idea, and I think that more and more people are going to be moving towards that. I think that the governor will have some interesting information for us in the near future, and he's definitely taking those kind of things under consideration.
Well, if a husband and wife are at home alone, and they're by themselves, nobody coming in or coming out, why do you have to keep disinfecting the surfaces?
You don't have to. That's a really good question. If you both are staying home and not going out, yeah, please don't spend all your money trying to buy bleach wipes and clean everything off. If it's you two, they're isolated at home alone, you're not going to get it.
All righty. I couldn't understand that. Thank you.
Have a great evening.
Dr. Watson, are you on with us? So there's another question about the availability of testing. We have a lot of questions here. Is testing available for anybody who wants it? Do you know?
Not right now. There's not enough testing for just anybody. Right now we're really focusing on people that have symptoms and people that have high risk. We are going to try to accommodate everybody that we feel are high risk. And in the future, the very near future, that might change. President Trump is actually trying to increase the number of circulating tests out there. And if that is able to happen, many more people will be able to be tested. But right now we're really focusing on those that have convincing syndromes or have high-risk travel.
All right, and I did get a letter from the Charleston Area Medical Center, and they were concerned that the standard of care for this virus was being treated the same by Centers for Disease Control and Department of Health as the H1N1. And they were saying H1N1 was airborne, and they're saying this one was not. It's droplet, which we've clarified is in fact accurate, even though they were being cautious at the beginning, it sounds like.
Yeah, I think that's reflected on the fact that the CDC is always very cautious at the beginning.
Okay. Well, we were about to put into the law that we voted on at 1 in the morning Saturday, the same standard for airborne as on coronavirus, even though it does not appear to be airborne. And that was a great concern to the hospitals in West Virginia that wrote me this letter late Friday night concerned. It looks like we took that out of the final version. So I just wanted to clarify that for one of the discussions we'd had. Let's go ahead to the next caller. And again, appreciate everybody calling in from the 17 counties. Barbara from Hurricane, you're on the line. Go ahead.
My question is, there's been a lot of talk about the older senior citizens, of which I am one. But it seems to me that if you are older, any viral infection like that is going to be normally more difficult for you than for someone younger. Is this the case with this virus, or is it especially difficult for the older individual to fight?
You're right in both counts. It is usual for the elderly to have more difficult with respiratory viruses. But also, this virus seems to be particularly difficult for the elderly, and we think that might be because it's similar enough to some other viruses that the elderly have seen that their immune system is being kind of tricked by this virus. And that may be, there's a theory going on around that. Don't quote me on that right now, but that's a going theory right.
Thank you so much.
You're welcome, Ms. Barbara.
So one of the other callers has a question, how long will it take to get the results back? And we talked about that earlier in the call. You get tested, the results come back in 2 days?
It's 2 days. It's decreasing. It was 4 days. It's down to 2, and we're hoping in the near future it'll be down to about a day.
Okay. Let's go to the next caller. Again, this is Congressman Alex Mooney, Dr. Eggleston, and Dr. Simmons, taking your calls live here in Martinsburg. And Geraldine is on the line. Go ahead, Geraldine.
Yes, I had a question that reading online in China that this might have started from like bats and then maybe the sale of like snakes or places where they sell fresh fish. Now, how did it get transmitted from that to humans?
There are a lot of viruses that have what's called a reservoir or a natural host animal where it circulates a lot of times. And when humans are in close contact with certain animals for a prolonged period of time, we know that we're able to transmit viruses to and from them. It's not that uncommon. It happens in a lot of viruses. And so we were not surprised to find out that there was an animal reservoir or vector.
Okay. All right. Thank you.
You're welcome.
Thank you. So another questioner that was on there asked, does the flu shot prevent the coronavirus? And again, explain that one more time with the flu shot, if that has any effect on this and why not.
It does not, and it's because they're from different families of viruses. Different families of virus have different genetic structures, and so the vaccine that protects against influenza will not protect from another family of viruses such as corona.
Okay. Any more on that one? Okay. So thank you again. We'll go ahead and just go to the next caller. We'll get as many calls as we can in here. And I believe Rhonda from Clay County is on the line. Rhonda, go ahead.
Hi, Congressman Mooney. I just said my name is Rhonda. I live in Clay County. I own a business in Kanawha County, and I'm also in the food service industry. And I'm also a licensed healthcare administrator, and so I work in healthcare facilities. In addition to that, I personally have a compromised immune system. I haven't panicked over this. I'm still trying to differentiate the difference between this COVID-19 and any other virus that I typically protect myself from anyway. So this one has commanded such a national response, but I have yet to see or hear why it is so different and so more dangerous, much more dangerous than any other virus that I would have to protect myself from.
Well, the problem with it is that this virus is called a novel virus, meaning that we don't know that it's ever had exposure to the human population before. Because of that, it's less predictable for us to say exactly who's going to have what outcomes. We have early data that appears that people with chronic diseases and the elderly, as well as people with compromised immune systems, have poor outcomes. But as I said before, that's really true for a lot of viruses. The difference is that we're seeing quite a higher number of cases circulating very quickly, and this is probably because we've not seen it before. So that we've never seen this, so systems are still trying to figure out how to deal with it.
So it's just the lack of knowledge around COVID-19 itself. It's an abundance of caution, per se.
Absolutely, because this is the first time we've ever dealt with it, and so we're still trying to figure out how the normal host response will go.
Okay. Well, thank you. That makes more sense to me, and as you can probably tell, this is personally affecting not only myself, but my business and my employees, so I just wanted a little more information because I was missing that piece of why it was commanding such a national response compared to other viruses.
Yep, I understand. Best of luck. Be safe.
Thank you. Let's go ahead to another doctor on the line here. I'm not sure it hit. And give us a little bit of an update of what you're seeing. Again, thank you all for calling in. Dr. Watson, are you with us now?
Yes, Congressman.
Yeah, go ahead. What are you seeing out there in Roane County? We can't hear you, Dr. Watson, if you're out there. So to follow up on the other question, though, okay. Maybe this is Dr. Eggleston. I've seen. Let's ask this again. I've seen at first when this came out, nobody in New York City said no more than 500 people in a room, and then I saw an advisement no more than 200 people, and I've seen 50, and recently I've seen 10. Is there some sort of advice about how many people should be together, whether it's church or the supermarket? I went to the supermarket. There were more than 10 people there. There were more than 50 people there walking around the supermarket. So what is the advice? Is there any standard there for, is that going to be continually moving, or is it, just explain, is there an advice, and why is it that number?
So I think the reason that you've seen the changing advice is as this very rapidly moving situation has developed, we've learned more and more about the distance we need between everybody and the measures that seem to work to slow it down. And so it's really just like with any, crisis that happens quickly, you change, you adapt and change depending on the new evidence that comes out. And I think the president let everybody know that the recommendation is avoid 10 or more, and that advice has to do with realizing that we need to really slow down this spread. And I think one thing to think about is 10 people in a 10-foot room is different than 50 people in a 500-foot room, meaning that if you can, I think part of the 10 recommendation is because most rooms, it's hard to be 6 feet apart if you're 10 or more people. But if you're in a very large room and you have 20 people and you can have lots of space between you, you might make a different decision. It's really all about what we talked earlier about, that arc of droplets and where you think you can be infected, and 6 feet and beyond, you are likely okay. The last thing for everybody to think about is how much time you're exposed to people. So the grocery store, you're just passing by with your cart. Right. And you might want to chat with your neighbor like we all do in the grocery store, but keep your carts end to end and you're probably, 6 feet apart. So you don't, it's how long you're together and how close you're together. And I really don't want people to be afraid of going to the grocery store. I would recommend, as you mentioned, make sure to wipe down the handles of the cart and to have your wipes with you. And for example, we all don't think about it, but often we sign for the credit card with our finger. Right. Just clean your hands off or wipe off the credit card machine. But people need to go to the grocery store. And as I said earlier, if you can help out an older neighbor or someone who has a lot of illnesses, offer to go to the grocery store for them.
Thank you. That's good for clarifying that. Let's go ahead to our next call. She dropped off. Okay. And I believe we have the next call would be Wayne from Charleston. Wayne, if you're on, go ahead.
Hello. My question has to do with the person who has been determined that does have the virus. I'd like to know how long that person would be considered to be contagious. And secondly, once he has recovered, will he have developed an immunity, or could he possibly get it a second time?
So to the first question, the current guidelines are at least 14 days. If a person is known to have the virus, they need to stay away from other people, quarantine by themselves for 14 days. To the second question, I don't think we know the answer to that yet, whether people can get, a new infection. With a lot of viruses, you can get a second go round, but it might be milder because your body's built up immunity. And there is the assumption that with the coronavirus, if you got it again, you'd have some immunity built, but it's really not known at this point because we're still learning so much about the virus.
Well, considering the 14 days, would that be 14 days after the person has gotten over the virus, or is that 14 days from the day he actually has the symptoms?
So 14 days after getting over the virus, because some people can have a prolonged course.
So, but if it extends out for 3 weeks, then you should wait 14 days after the end of the 3 weeks.
So you want to be clear. Mm-hmm. And those guidelines may change, but for the moment, you want to have that time to make sure you've entirely cleared it.
Okay, thank you. We have time for a couple more calls, and you may press *3 on your phone to any time to get in the question queue. We have a lot of callers on the line still, and we're about to wrap up here. But if you have a burning question that we haven't answered yet, you may press *3 at any time to get into the question queue. You can send me a message at mooney.house.gov after the call. Call my office at 304-925-5964. Dr. Watson, are you with us now?
I am, if you can hear me.
Yeah, we can hear you. So I know you're out there in Roane County, and you've been dealing with this a lot and doing radio shows. How's it looking out there, and what advice might you have?
I've really enjoyed all the information I've been listening in on the call for quite a while. It's really applaud your healthcare professionals there. We're in Roane County. We're preparing like everybody else is, waiting to see if we're going to have an outbreak of this illness, as we assume that we are as likely to have it anywhere else in the country. And thankfully, we haven't had a big outbreak yet. But we've been making lots of plans at the hospital to kind of change the way we do business to accommodate a large influx of patients if they come, and to be able to care for. We're a critical access hospital, 25 beds and no ICU, but preparing to take care of much sicker patients if truly we have a large outbreak and the healthcare system's overwhelmed. So it's been interesting for us to kind of go back and look at the way we do things and think about the way we could do things if we needed to. So,
someone comes in there and needs a test, can you test them?
We can send tests out through LabCorp or through the state lab. We don't have point-of-care testing yet. We're trying to get those devices in, I think, like a lot of people are. So,
are you seeing a lot of other either diseases, viruses, or flus coming in?
Our flu numbers have gone way down recently. We still have some flu A primarily is what we're seeing right now, but we've seen those numbers kind of tail off for the past couple of weeks here locally. Lots of other respiratory illnesses, which we don't usually test to see what they are, as long as it's not flu that you might want to give Tamiflu to. We don't do a lot of other viral panels just to identify a different virus, since you're not going to treat them any differently. So, but we've not been overly busy at the hospital for the past week. I don't know if people are hearing the message that you should be careful about going to places where you can pick up coronavirus, or if it's just one of those fluke times for us. But it's been pretty reasonable at the hospital now, which is nice. It's given us more time to plan for kind of worst case scenarios, so we're prepared if they happen.
All right. Thank you, Dr. Watson. Let's take one or two more questions before we have to wrap up. Appreciate everybody, participating and doctors being here. Why don't you go ahead and read that one more time? What is that for? We gave a number at the beginning of the call. We're going to give that number again.
Yeah, so just to repeat, the State Health Department triage and advice line that is 24/7. It is 1-800-887-4304, and they can answer a lot of your questions.
So follow-up specific medical questions, 1-800-887-4304. 1-800-887-4304. Let's go ahead. We have Michelle on the line from Paw. Are you with us, Michelle?
Yes, I am. Thank you.
Go ahead. Yeah.
I had a question. My son, he had a cough yesterday, and he seemed fine in the evening. And so he went to work this morning. And you said that you're not testing. He's 26, that age bracket, because he has no illnesses or anything. So when they get a cough and then they're fine, or they get another cough, you can't keep a person in quarantine for, ever. So, and you're not testing them. What do you do?
Yeah, so I think lots of people can have coughs for all sorts of reasons, as we about, and people can have it with allergies. They can have it with reflux. They can have it with the usual just viral things that are passing around, and there really are a bunch all the time at this time of year. So the recommendation isn't that you quarantine anybody with a cough. I think what we're in this difficult time where if you have a cough and fever, and I understand he doesn't have a fever, and the fever is actually a really important thing we look for in terms of our recommendations for people. But if he has a cough, what I'd recommend he do is, speak to his primary care physician, get a sense of what might be the cause of the cough, and then if there's any concern, like high-risk contacts, as we've talked about, or cough and fever with other concerning symptoms, then it may be decided that a test needs to be sent on him, but local doctors, emergency rooms, and urgent cares are able to answer those questions. While I'm on the topic of emergency rooms, I think it is important that we not flood them with patients who don't have really significant symptoms. So that's why most primary care and urgent care are a good place to go if one has questions in the absence of a concerning contact or significant symptoms like a fever.
And can you repeat the symptoms again of the coronavirus, what the symptoms are for that?
Yeah, so people tend to get cough, fever, muscle aches, feel tired. It can be very like the flu in that way, and they can have sore throat. Some people do get some diarrhea, but it's very, very common for people to have a fever as well as a cough.
Would you need all of those or just one of those or two of those?
So I think the main thing are sort of respiratory-like symptoms with a fever.
Okay.
And it's not that it can't happen in the absences of a fever, it's but that it's much more usual if it does. And one thing for everybody to realize is that elderly patients tend to not spike as high fevers. So, you know, the early advice was a fever of 100.4 or higher. Now it's gone down into the 99.7 range, and the reason for that is that older folks tend not to mount as high fevers.
Okay, let's do one last question, and then we're going to have to wrap it up. We have Eric from Buffalo. Go ahead, Eric.
Yes, thank you, Congressman Mooney, for this session. This is very informative, and they probably answered, I think, my question. But I work in the county school system, and we were wondering about our filters. You know, our schools still have personnel in them currently, but how long, you know, I was asking about how long the virus can live on surfaces and how about filter changes, you know, how long is it airborne, is it, you know, but I think you've answered most of the questions that I had. Another question I have is I heard a comment was made that the reason why the virus and these flus and viruses die out in the summer is because we get more vitamin D through sunlight. Is that the case? I mean, can we be taking vitamin D to help maybe curb this thing, or be out in the sun every chance we get? Would that help?
So
thank you for that question.
It's a good question, and two quick things. One is I would talk to your health department about the filter question, because even though this is likely predominantly droplet, we are being careful about filters and HVACs and recirculation of air. So, and I'm no expert in that, but I think if you have concerns, the health department may be able to help you in terms of the, you know, changing filters and all of that. I don't want to give the message that in terms of vitamin D, that's a great question. So we don't have any evidence right now that people's vitamin D levels influence their infection or recovery rate with this virus. I think that that getting outside and being in fresh air and getting sunlight, because that's how most people generate their vitamin D, as you're saying, is important. And for overall health, and your stamina and all of that, vitamin D is quite important. So I think having good vitamin D levels is an important thing for overall health, but we don't have evidence right now that vitamin D repletion prevents infection or changes a person's outcome if they are infected. But great question.
How about vitamin C?
Don't have evidence there either.
All right. Stay as healthy as you can. Well, it's 6 o'clock, and I know the governor has a press conference, and I want to just say very huge thanks to Drs. Eggleston and Dr. Simmons for your participation. These have been very informative. If I did not get to answer your question, you can visit mooney.house.gov to send me a message. Call my office at 925-5964. I stuck to the questions that were mostly healthcare related. I know some of the questions in the queue I didn't get to were more policy related about the laws. But to conclude, this virus is obviously serious, but we can take common sense precautions, wash your hands often, scrub with soap for 20 seconds, stay home if you're sick, and disinfect frequently. And that is it for the evening. God bless, and everybody be safe. Goodbye.